about endovascular treatment of complex intracranial aneurysm using intrasaccular devices. Wide neck bifurcation aneurysm pose a significant challenge to the treating clinician due to the need to preserve the bifurcation vessels. And intrasaccular flow disruption is an innovative technique to address this issue. A contour device, web device and neck stents are the novel tools to address the issue of a wide neck bifurcation aneurysm with the intrasaccular flow disruption technique. These are some of the pictures showing the contour device. Looks like this after deployment, and this is the site where detachment site. The web devices also comes in various types. This is the single layer device, which is made up of nitinol wires with platinum core, and this is double layered where there are 3 attachments, proximal, middle and distal, and this is again a single layered spherical kind of web device, a smaller version, and this is a neck stent. We report our initial experience with novel intrasaccular devices like contour device, web device and neck stent. In this article we discussed various aspects including indications, device selection strategies, technique of procedure, antiplatelet therapy, potential complications and management strategies for residual or recurrent aneurysms after initial treatment with these novel devices. We collected all the data, the pre-treatment images, immediate post-treatment and follow-up angiographic results. Our protocol is to do MR-angio after 6 months of the procedure. As of now, we have only treated 4 patients with these kinds of devices, among which 3 were females and 1 was male, with a mean age of 54 years. And this is data from our hospital, a single center. So in total 4 aneurysms were treated. 1 was basilar top aneurysms, as I'll show later, which was treated with neck stent, and another basilar top with the contour device. And we had a ACOM aneurysm and DACA aneurysm, which were both treated with web device. Additional treatment in the form of coiling was instituted for both basilar top aneurysms. And among both 4 aneurysms, the basilar top and ACOM aneurysms were ruptured. The patient with ruptured ACOM aneurysm also had hydrocephalus, for which we placed Omaya, and later VP shunt was placed. At 6 months, mortality is 0%. We did not have any procedural complications in any of these patients, and we only have 1 patient who has 2 patients who have reached the 6 months timeline, and we have 1 MR-angio among the 4. This is a basilar top aneurysm which was treated with contour device. This is showing a clip while the catheters are being negotiated. And this is the final image after putting the contour and stents. We had a case of DACA aneurysm. This is the pre-deployment while the web device is getting deployed, and this is the post-deployment image. In this patient, we offered the patient surgery and endovascular management. However, this patient chose to go for endovascular management, and since the neck has vessels and both were dominant, the good lumen, we chose to put web device. We also had a case of ACOM artery aneurysm where again we placed a web. This is the clip showing the web device being deployed. You cannot see. This patient also underwent Omaya chamber placement and later on VP shunt insertion, for hydrocephalus. This patient we tried doing coil embolization, but it was not possible to negotiate, and the relatives were given option of web device. And, after that we proceeded with web device placement. This is my last case with large basilar top aneurysm. This was a giant aneurysm with PCS coming off the neck. So we placed neck stent with coils. This is post-deployment. Only for one patient we have MRA imaging. That is a patient who underwent web device placement for DACA aneurysm, where there is complete obliteration of the aneurysm, no residual, no recurrence. In conclusion, intrasaccular flow disruption seems a safe technique with promising efficacy profile in wide neck.